maturity, experiences that maybe a direct college graduate wouldn't. Is that answering your question? Am I giving you a flavor of that, or do you need something more specific?
I mean, that was an excellent answer. But, like, what would you do? Because you said you meet with people one-on-one like that all the time, and so what would one do if they wanted to get the opportunity to meet and kind of explain that?
All you have to do for me, Dr. Catalano would do the same, I'm sure. Dr. Thorne would do, is just call us and set up an appointment and say, I'm a pre-med student. I'd like to meet with you to go over my current state of affairs and to get your advice regarding the potential for me applying to med school. More than happy to do that. And even if you didn't apply to our med school, I mean, we're here to help you become a doctor if that's what you want to be. And we have a lot of information that can help you with that. You can go on the web, as Dr. Catalano's put up, you can go on the web and call the med school. I mean, there are numbers that are available to us. Call the admissions office. Say, listen, Dr. Stallworth was here the other night. He told me I could set. They will get you to a number that will set you up. Some I talk over the phone. You know, this is a drive down there. But sometimes you convey a lot more in person to me than you do over the phone regarding those other aspects of medicine. But Catalano's 40 minutes away.
Yeah,
It might be easier for you.
If you could leave an email address and number, but any of us would be happy to meet with you, be it in Columbia or in Greenville, to do that. I want to take that a step further. What do you have to major in to go to medical school? The answer to that is you major in whatever you want to major in. The mistake that I made is I put blinders on like a horse at a horse race, biology, and took very few religion courses, English courses, history courses, and I regret that to this day. And at the very least, a quote-unquote non-traditional, non-science major, or someone who comes to us after graduating 2 or 3 years ago and has done something completely different before deciding on medical school, is an attractive candidate, helps with diversity, which is important to us. As long as Dr. Stallworth said, you can be sure to assure us that from a science standpoint, you can do it as well. But don't force yourself to be the right major. The right major is what is best for you, because if you study what you love the most, you're going to do better than if you're forcing yourself, for example, to be a chemistry major or a biology major. Any of you in here who are majoring in a non-science, you are just as competitive as your peers that are majoring in the science, as long as in the science courses that you do take, because you have to take some in regards to prerequisites, you do well. And I really want to emphasize the fact that you don't have to go through and follow the typical course. Because sometimes the typical course, like Dr. Stallworth said, will bring to us a student who is not yet ready from a maturity standpoint to take on the rigors of medical school, whereas someone who has had a less typical course, been out for a couple of years, or majored in something other than science, comes and knocks the socks off of the admissions committee. So never assume that you can't do it without, at the very least, contacting any of us and letting us talk to you one-on-one.
You have to have the prereqs. For us, it's a year of biology, a year of English, and 2 organic chemistry. Right? They changed it. We said physics, but we got rid of it. So you have to have those courses to apply to medicine. And
Physics might help you on your end.
right. And the reason for us is it helps you. It's not that we're trying to be so structured.
I just wanted to interject also that that's what Dr. Smith is here for on our campus. So when you're here and you feel like you're in that position, you're in a different major or whatever, Dr. Smith's here to tell you what the requirements are for all the med schools and how to get you in and get your application where it needs to be and stuff. All right, stuff in the board too.
Does research, like, if you've done research while you're an undergraduate, does that help?
I think it's a compliment to your application. I think it certainly doesn't hurt. I think that depending on what your application strengths and weaknesses are, you can really work to maximize those strengths. Do you have to do it? No. But I do think that for certain applications, it really is a nice addition. But I'm going to tell you, in this whole process of what you've done, and this is where this interview comes out, and even if you take research, the interviewers are really going to come at you not with just you did it. Is it, what did you get out of it that is going to show us and give us validation and clarity that fits your wanting to be a physician? Do you see what I'm saying? So again, many times in the interview process, if you give us information, which is great, the follow-up question is the zinger. And the follow-up question is going to be, why? Or the follow-up question is going to be, how did you validate that for me? Not that I think you're lying to me, that's not the point. But I've got to have depth of answer. I've got to have more than just, I want to be a doctor. You know, it's going to be why. It's going to be validate for me the answer you just gave me, so that I can know that it's got depth, it's got purpose, it has weight to it. You see, so that's where that interview comes in. The interview is not just a superficial, you want to be a doctor, good, here's your GPA, good. It's investigating in that sort of manner, because we're looking at that drive, that passion, that the ability to have that focus and direction, and it be based on solid evidence as opposed to superfluous information like, well, I love to watch ER on TV.
Oh, go ahead.
How many students from Clemson got accepted into USC school message? Okay, I have to go that far on that. I don't know a rough number.
How many got accepted? I mean, I would tell you that in their class right now, there's about a dozen. You know, it's usually second right after USC as far as number of students. As far as how many got accepted and then chose to go other places, I'm not sure what that is.
If you look at the schools, I think USC is number 1, Clemson number 2, Wofford number 3, basically in terms of numbers of matriculants. But see, you have to be careful about numbers. The point is, how many were accepted but chose to go elsewhere versus how many, you know, were accepted and maybe only accepted by us or accepted and obviously matriculated by us. But it's the second number. And, you know, there's always typically that elephant in the room of Clemson versus Carolina. And it's kind of funny. We love to engage in that. And there's all sorts of competition among the students representing the two schools. We just talked about one of the students, Jeremy, who is from the school, who had to wear the, I don't mean to bring up a subject issue, this is an example, but had to wear the Carolina Gamecock because of the football game. They had a bet going. But, you know, at this level of education, it's really embracing. I have 2 students of my 11 right now who went to Clemson because I teach at the 3rd year and I teach pediatrics. I'm in charge of it. So I have 11 students on the divided into groups and 2 of them go to Clemson. I was telling them I was coming today and they were so excited and would have loved to have come with me up here. So we have a really good working relationship. I think sometimes I've heard there's a student, oh, I wouldn't go to Carolina because it's Carolina. I go, ugh. Boy, I say, guys, we're talking about medical school and being a physician. And we're talking about certainly not at all disrespecting or not pulling for, or however you want to put it, where you went to college, which I will plug you right now, which is Alabama, national champion. But we do it in a very collegial and reasonable way.
Dr. Stallworth mentioned the wooden stool with 3 legs, and I think we beat GPA and MCAT to death. But in that 3rd leg is included the interview. Let me also say something about letters of recommendation. Be sure to get letters of recommendation from individuals with whom you've worked closely and who know you well. Any of us can write a letter of recommendation after meeting with you for 5 minutes saying you're a nice person, you'd probably be a good doctor because you maintain good eye contact. Well, you know, that's not the kind of letter of recommendation you want. An individual who can comment on your work ethic, your participation in class, the attempts, for example, that you made to do some additional research or to perhaps TA in a class when you're a senior. Your letters of recommendation, for the most part, should be from professors, not from personal associates. Nothing wrong with personal associates, but obviously they're going to say you're great, and through no fault of their own, they're really not able to comment on your academic abilities. Now, if you have worked with a physician shadowing him or her for the last 6 months, that's a good recommendation. If you were in and out of his or her office for a day or two, that's not going to be a particularly strong recommendation. So choose your letters of recommendation carefully. You can have all the numbers and you can have all the right letters of recommendation. Without clinical experience, you will have a difficult, if not impossible, time getting into medical school. So make sure that clinical experience includes enough time with a physician so you can look us in the eye and really give us a sense of, yeah, I know what I'm getting into. I was up at 5 in the morning making rounds, and I got home at 9:30 that night, and I hadn't had anything to eat, and I did that for a period of a month, and I really know what it's like to be a surgeon. I really know what it's like to be a pediatrician because I spent 3 months in this particular office. And quite frankly, because of HIPAA, clinical experience is a little bit more difficult to get. We realize that. Dr. Stallworth has a program at USC that I know he can talk about where students are able to take, is it 6 or 8 weeks for you?
It's 4 weeks.
It's 4 weeks. We have a 4-week rotation that many Clemson students do at the Children's Hospital in Greenville. There are research opportunities that also put you in front of patients. There are free clinics, and you really need to get out there and beat the bushes. You need to meet the HIPAA qualifications and the HIPAA requirements so you can get that clinical experience. Because if I were to say what really hinders an opportunity to gain entrance to medical school, despite strong GPAs, despite strong letters of recommendation, despite strong MCATs, if you don't have clinical experience, we're not sure that you know what you're getting into. And we don't want you to start medical school, do very well for the first 2 years, then in your 3rd year start to see patients and you go, ugh, I didn't know it was going to be like this. So those are some of the other things that you need to consider. Letters of recommendation, clinical experience, volunteer experience, interview, all make up that 3rd leg.
Let me just tell you, I'm sorry, but we have an awesome handout for letters of recommendation. So when you guys start thinking about getting your letters of recommendation, you need to come see me, Anna. We've got a really good handout to really tell you exactly what you need to do for that. And then for the clinical experiences, you need to see us as well, because we can direct you to these internships, and we can also tell you about other opportunities around in the area. So please take advantage of us here as a resource, because we can probably provide you with a lot of this good information.
This is just quick. Is it, when you're going to shadow and get clinical experience, is it better to shadow multiple doctors in multiple different fields, or really focus on maybe one doctor in one practice and spend a lot of time with that one person, or so few?
I don't know that it really matters. I think it's more of the experience under which then you can verbalize back to us and validate to us that that experience is going to fit in to your being able to answer about what medicine is going to be for you. Let me flip another. If you said, well, I shadowed one doctor one afternoon, or you're going to have, so it has to have some weight to it, it has to have some substance to it so that you can really have that experience. But I don't know that it really matters. I think if you were going to get a letter of recommendation, I think that the one who obviously had you over a long time is going to be a lot more reflective of being able to write a letter of recommendation. Sometimes, however, those shadows might not be the best letter of recommendation, not because they're not good, not because they're not, but do they really know how you think? Do they know the academic course? You know, in college, your professors know